Good seeing everybody. Okay, it's 2:36. We're going to start right now. So thank you, everyone. I do apologize in advance if I'm not looking directly at the camera. I'm going to manage Zoom here, and I got the WhatsApp chat on the other screen. I'm talking to Patrick, and then got a presentation to share as well. So I've got three screens here. So if I'm doing a 180 swivel, do forgive me. Good afternoon to everybody. From Hong Kong, obviously, where we're based. I'm Anthony, Director of External Affairs with ASBA. Full name, Asian Business Aviation Association, for those who might not be familiar. I do welcome all of you to the episode 2, as you see on screen, of the ASBA Aircrew Mental Health in COVID-19 webinar. We started this, Katie, I believe, at the beginning of this year. That was episode 1, and we had panel discussion between you and I. At that time, it was mainly a presentation where we had slides coupled with some Q&A. For this discussion, we thought hard about how we should improve upon that, how we can make it a little different to tackle some of the more unexplored topics. And so we decided, all 4 of us here today, the 4 speakers, to lead this webinar with a more discussion-driven focus. Okay, so for the audience here, think of this as sort of a podcast style, in this case, like a video podcast. And so instead of speaking to the audience directly like we normally would, we would speak with each other, right? The 4 of us, to each other, with each other, and so the audience can sort of listen in like a fly on the wall, to almost eavesdrop, if you will, on a closed door discussion for the 4 speakers here. So we come from 4 perspectives. Captain Patrick Roa is a pilot himself, a veteran pilot. I think he just ferried an Airbus from the U.S. to China. And just went through 3 weeks of quarantine in China. He's checking in now at the Pudong airport. Katie herself, human factor specialist and CRM trainer, MD of One Crew as well. I was a former crew. And we got David Stace from MedAir, a sponsor, right? So we come from various differences in our backgrounds, in our experience. And so we hope that this kind of difference in approach will have a positive effect on how in-depth we can go on these topics. Of course, we greatly appreciate a sponsor for the event as well. That is MedAir. And so MedAir has been a long time ASBA member and a strong advocate for ASBA's both health and safety initiatives. And so we do thank MedAir for the support. And we have David Stace today from the UK, bright and early from the UK. Katie, as you may recall, when we had our first episode, the mission really was to chisel away at the stigma surrounding aircrew mental health, right? Now, you were a former cabin crew. You obviously have a lot of experience with, as a trainer as well, dealing with flight crew and cabin crew. Can you walk us through briefly some of the highlights that we went through together from the first episode? Let's get a recap, and then get people caught up to speak with the first episode, and then we'll move on to our second episode. Thanks, Katie.
Good afternoon, everyone. I certainly can do that, Anthony. But first off, could I please take the opportunity to thank ASBA, to thank yourself, Anthony, because this is something that is very close to your heart, that you're very passionate about, for allowing this platform to occur. And not only that, but the commitment of ASBA to continue a mental health series, because you realize how important this is, that you're making it into a webinar series, if I may. And
My
thank
pleasure.
you so much. Thank you so much to all the participants for, time is precious to all of us, and for making it to be here. Please also know, if for the panelists that are here. The four of us, although we're coming from different perspectives, we're also here to learn from one another. I think we can all in this room together appreciate that COVID is unprecedented and things are ever changing, and that we're here to learn as well as share our knowledge and experiences. So if I may summarize series 1 webinar, we took over an hour. I'll summarize it in 3 bullet points.
Sure.
The first one being where we were then, and then where we needed to be, and what can we do individually. Where we were, I think we kind of opened the discussion with the stigma around mental health. We discussed extensively why aircrew, but in particular, were uncomfortable to discuss mental health issues. Some of the barriers to seeking help, such as the stigma, the implications on their licenses, also even cultural acceptance, right? Especially in this region, in Asia. We then went on to discussing, well, what do we need to do? And I think first off, we needed to distinguish between what common mental health is, kind of the COVID-inflicted anxiety, panic attacks, and depression, and that is on a continuum. It could be serious, it could be mild, right? It could be while you're on your, as Glenn mentioned, 100 over days, over 100 days of quarantine in the last year, right? It does affect us versus the major mental health issues, disorders such as clinical depression, schizophrenia, and all of that. I think we needed, as the industry, to distinguish between the two. And then in that hour and a bit in series 1, we then started to move into what do we need to do? So what can we do individually? And I shared a little bit about One Crew and our initiative as an external training provider to business and commercial aviation. We started incorporating emotional resilience development training in 2020 as part of our CRM training agenda. And then for the bulk of this year, we started doing a mental health awareness with an emphasis on the practical application, the communication tools, and how to show empathy to someone, a colleague that may be in need. So I think that kind of led us to where we are right now. I think we also then started in discussing the possibility of conducting our own surveys out of the survey discussion that Harvard's School of Public Health first initiated. We then had a chat between ASPA and One Crew whether there's a possibility for us to initiate our own survey that's COVID related. And I think that brings us up to speed.
Thank you very much, Katie. I think if I recall correctly, that first episode, we actually scheduled for 1 hour, and then there were so many questions in the end, and it lasted really until I think it was an hour and a half, if I recall correctly, which is why we also scheduled this one for at least an hour and a half. The response was overwhelming. Let me bring on our third panelist as well. David is already here. David, would you happen to have the webcam enabled and your mic unmuted? There you go. Oh, nice background too, David. Very nice. You're still muted. Let me see if I can. Oh, there you go.
Hello. Good afternoon, good evening, or good morning, wherever you are logging in today.
We have worldwide.
Good morning, David.
Hello. Hi, Catherine.
Hi.
Hi, Anthony.
Hi, David. While Patrick is still going through the check-in process at the airport, the three of us are just going to get right into it, and then I'm going to bring Patrick in when he's able to come in. How about I'll start with former cabin crew here first, Katie, and then I'll go with David. Can each of you give your sort of latest sit rep, right, like a situational report on where you feel mental health is now for air crew? Where are things now? Were they any different than, let's say, early this year when we had our first webinar? Are they getting worse? Are they kind of stagnant? Where are we, Katie?
If I could share my perspective
Yeah.
from facilitating training courses for aircrew,
Yes, please.
primarily pilots, flight attendants in business aviation, I kind of, in my experience, there's almost initially when we first started the topic of mental health awareness as part of our crew resource management training, there were kind of three school of thought, if you will, from the participants of aircrew. One category is this is not relevant to me. Life is as happy as things can be, and COVID doesn't affect my emotional resilience. And then we have kind of the second group who are there and go, oh, okay, this is interesting. I'm going to keep an open mind. I'm going to see what's in it for me, how I can learn. And then if I'm comfortable, then I'll start sharing my thoughts and perspective. Mainly out of curiosity. And then, of course, we have the third group where this is affecting me right now. I'm in class with you, but I'm actually in quarantine on my 20th day, right? And it's really affecting them. So I kind of see these three different perspectives initially, and then as the year progresses, I start to see things quite different. It's interesting for the cabin crew. Initially, they tend to almost enjoy being in quarantine the first time round because it's physically very exhausting for them. Their jobs very physically exhausting, and they just spend the first few days sleeping, resting, doing yoga, and just relaxing. And I also hear by the second and third quarantine stint, right, that's when it starts to affect them. And they go, okay, I'm about to go into my third 21 days quarantine. I really have to start getting myself mentally prepared. Interestingly, when I speak to my commercial aviation colleagues that are flight attendants, they tend to have more of a network, a support group where they can talk about these things. They check on each other's welfare regularly. But interestingly, not as much with the pilot community, not while they're at work, maybe off work. I was grabbing a sandwich earlier, David. I mentioned to Anthony at a cafe before I came back to this. And I sitting next to me were two pilots, and they were talking about how this current situation is affecting them being on base. They're having to manage around their families, as well as how the uncertainty of the job is affecting them. So I think what we're discussing is very topical because I just came from lunch and overhear people talking about it. What about you, David? What's your experience?
Well, I come from a perspective of being a counselor and psychotherapist. I have training within the aviation industry. I'm delighted to be here from your sponsor, Medair, and as part of this discussion. And I have supported many airlines and their airline personnel throughout the pandemic and before. So I'm very well in the issues that can be surrounding flying. I'm also, looking at the perspective of the industry is still recovering from the pandemic. So we have very different and varying stories. For instance, the Emirates are recruiting 3,000 cabin crew and 500 airport personnel. And their capacity, though, is still only 70%. Cathay Pacific, for instance, are running at a lower capacity. They're still under 30%. So it depends. If you're in the aviation industry, it might have affected you in very, very different ways. And as you were mentioning earlier, Katie, the experience now of the quarantine and using that for rest, it's a sign of how much pressure there really was when we were in the old normal, when sleeping patterns were interfered with. It led to fatigue and a different view from an aircrew perspective in terms of those people that were experiencing the fatigue, and management who were trying to deal with it. And there seemed to be a kind of mismatch between the two, almost a them and us situation. And so I think from my perspective, it depends where you're coming from the pandemic, what your experience is, whether you've SOS. And those are very difficult things to deal with when your family has been affected and you cast it aside, and you have to be professional and not showing your emotion when going on a trip. So for me, the challenges are many and varied depending on what each individual experience has been as part of the pandemic. Largely what you were saying before, some people have, you know, really coasted during the pandemic. They've had a great time. Others have been really severely affected by it, both financially and emotionally. And then others, you know, they've got through it. They're okay. So yeah. In my experience, there are very many issues which you would have experienced before the pandemic, but they've been heightened really as our experience of opening up and the challenges that presents come to the fore.
Yeah, David.
There are actually
Katie.
Sorry.
Go ahead.
There are actually 2 points that David brought up that I'm really curious about. One being the kind of management versus crew, because they all have their own priorities, right? I mean, in times like these, management really it's about survival. It's about keeping the clients. It's about maintaining, you know, the business, right? Versus the crew's needs. So I'm curious.
Client retention.
That. Yeah, as well as the other part, which is the individuals and what they're going through as well. So, yeah.
Yes. Maybe if I could use an example, I have had clients in the past who've discussed their use of antidepressants, for instance, and whether that would be disclosable with their company and what the implications would be if they did disclose such use, and working with them through that in order to establish whether there was a right for the company to know that they were on antidepressants as a result of a safety review for crew. And so this could get really, really tricky. So that those that are in the industry feel comfortable in disclosing their level of difficulty in dealing with what they're facing on day to day. Because let's face it, a flight is, you know, you're in a tube, you're with people that maybe you don't choose to be with. You have to put on a professional face. And you may have a number of that you might be dealing with. And so it's not easy. There is a mismatch between the mask that you're wearing as you're using your professional persona at work, and actually what's going on for you personally, and trying to balance those two things is quite difficult. And when you feel that maybe there is a difficulty in disclosing, even that you're taking antidepressants, which is a good thing because you're trying to deal with it, you know, you're maybe trying to help your brain to recover from something you might have experienced, loss or relationship difficulties or difficulties at home with financial difficulties. These are kind of real societal challenges that everyone is facing. And one route through the medical profession, through diagnosis, which isn't, by the way that I work. I'm a humanist and I'm an experiential counsellor and psychotherapist. I prefer not to work in the medical model. And I think that might be part of the problem, that we're actually already talking about disorders. And the language of that is sometimes perceived as negative, as something that you want to avoid, not disclose away. rather than seeing it as you're living, in a sense, a full human catastrophe, which is the fullness of life. And that, you know, you could, yes, describe it in disorder terms, but really in reality, you are a human being facing the challenges that come about as part of being essentially human.
I think there are a lot, so many variables. I mean, first of all, to echo what Katie and David said here, I see basically two groups, at least two groups. You have one group who's dealing relatively well with this. Perhaps, let's say they're bachelors, single, no families yet. Also, maybe they're kind of introverts. Okay, so you got a couple things going on. They're able to isolate themselves for 3 weeks, up to 3 weeks each time, and come out relatively okay, right? You have that group. They may be okay. They could even be okay enough to be able to share and be a support person for their peers. Okay, someone their peers can go to. And then I see another group who are not doing so okay. They, for example, they could be attached, married, could be going through a divorce, could be going through even a custody battle. I know a case like that currently. Can't see their kids in court because they were in quarantine for the jobs, right? Not doing so okay. And so I see two groups potentially, ones who are more or less unscathed, can help, would like to help, and you have this other group on the extreme side, on the other side of the same spectrum, who maybe even crying out for help silently, right? And so we kind of have this one discussion now where we can include two opposing viewpoints, if you will. It's part of the same audience. Both types are probably listening to this at some point. Well, what do you think,
Anthony? If I could add to
please.
those
I'm
groups.
just brainstorming. Yes.
Yeah, there's also a scenario where Group A, which you mentioned, the ones that kind of thriving through this, and Group B, the ones that are going through a lot of challenges. Group A not realizing at all what Group B are going through, and they're all colleagues. Right?
Yeah.
And that again is the stigma.
And they could be sitting next to each other.
Exactly.
In the cockpit, in the flight deck. Right?
Yes, or even
completely
friends,
unaware,
colleagues, friends. Yeah,
absolutely.
I think that's true. And if you feel that it may get back to management, then you're going to hold your cards very much to yourself in what you might be facing, and that is very lonely. Loneliness, in actual fact, is a killer. And to sit with your own problems, not being able to disclose it, adds to the pressure. I lost count of the number of times that I've provided support over panic attacks previous to flight, wondering whether it's possible to actually go in for another long haul. I've had also the unenvious task of helping a long-haul flight carrier to reduce their numbers and the impact that that's going to have on the personnel and their families. It's been very, very challenging times. Who doesn't know somebody that has been affected by the pandemic in terms of the health or the sometimes bereavement issues that you've faced during this pandemic? which has touched pretty much everyone in terms of loss.
Yeah. David, you brought out the point of loneliness, right? In this time, I think it's almost easier for people to discuss that they're having a down day or they've had a panic attack over something. But to admit to loneliness, I don't know if what the statistics are, but I would imagine that being a very difficult thing for people to admit. So I'm hoping that,
especially for the pilot types. I mean, most pilots are the alpha types. They're not going to want to admit much vulnerability, if at all. Patrick can speak to this later on if he's on. And so, it's having to juggle basically carrying this stoic professional image, if you will, for the sake of the jobs. And then at the same time having that sort of cognitive dissonance almost to maintain both. It's draining, to be honest.
Yeah, going back to what you're saying, Anthony, sometimes people do use their pain to help others because they're more in tune to other people's vulnerabilities and they're able to be there. And I think that helps them with their loneliness or their own kind of difficulties, I think. Yeah, David, I would love to hear your thoughts.
Yes, Katie, you can use your own personal experience as experiential touchstones to be able to give someone empathic support. And in that way, really a problem shared is a problem where that is possible and there is trust involved in the disclosure and talking it through. It is therapeutic to talk it through. There are areas of the brain that benefit from being able to talk about a problem, particularly the hippocampus, which is responsible for processing and memory and our sense of well-being. And so that's why counselling is so effective, to being able to talk about it if there are if there's no one available on crew to be able to discuss it with. So initiatives like Employee Assistance Programme, initiatives run by MEDAIR for consultations and mental health checkups. If you find a route to help and talking about it, then it's half the battle. And in fact, lots of research suggests that counselling is as effective as the use of antidepressants. So the outcomes are as successful when you go and see a counsellor as they are as if you're taking a course of antidepressants without seeing a counsellor. So going back to the issue of loneliness, Katie, they have done some big data research around the 5 major causes of depression, and loneliness is in the top 5, together with relationship issues, financial loss, chronic illness, and just an inability to connect with a general practitioner, a doctor, and much more common use of A&E to address a mental health issue, rather than really address it in a structured way or with an open relationship with your doctor.
And the costs associated with it, right? Whether it's covered by, I mean, there's the situation of, well, I need help. I have to pay from my own pocket because I don't really want this to be disclosed to my company or my insurance, right? So there's that to consider, and you have resources available at MEDAIR for the individuals, but it's how do you get to them, right? Is another thing, yeah.
This is the point I was mentioning earlier, the medical model rather than the experiential model. So I was aware that one of my clients disclosed that they had been diagnosed with personality disorder. They disclosed it to their employers, and their employers' response was to move them out of their role and out of the company. So that disclosure actually affected them severely. The person who'd been diagnosed was happy because they knew in some way what it was that they were struggling with all of these years. So it kind of gave them answers to questions as to why they were a certain way within their own life, but it had a catastrophic effect on their own family life in that they didn't keep their role any longer. So the threat, I guess, is very real. And part of it is the fact that we label this mental health rather than, wellness, a wellness issue.
Fitness,
it's
even.
not as if we're being diagnosed with appendicitis. And, there are a series of symptoms which can lead to the knowledge that he is suffering from an appendix and it needs to come out. But research has shown that there are so many appendectomies that actually don't need to be carried out. And so you can't really compare that with a mental health issue because the brain is so complex. We have 100 billion synapses in our brain, which is the same number as stars in the galaxy. So it's a very complex organ, and you can't really treat the brain in the same way as you would to diagnose an appendicitis problem. So I think the difficulty is the fact that we do describe it as a medical issue rather than an experiential one. And that's where part of the, bad press that mental health gets in terms of being able to talk about it openly.
Yeah. And from what I hear from my aircrew participants, also, especially for business aviation, there's almost an additional layer, which is, imagine if you've been diagnosed with certain conditions, not only do you not want to reveal it to the management companies, what about the client? God forbid the client, the owners of the aircraft should find out, right?
Yes.
Even if the management company has a system to support the crew, let's say fast forward a few years from now and there's systems in place, there's still the issue of, at the end of the day, they have clients they needed to, right?
Yeah. Yeah, I mean, I'm familiar with a lot of cases where this is an issue, this disclosure of being able to talk about it, and even though talking about it is helpful, and so if you're keeping it to yourself, then that's when issues do develop, and the part of the problem. I mean, just to give you an example. This is all led by the DSM-5 manual, the Diagnostic Statistical Manual for Disorders. Even in the language, you're already saying that there's something wrong with you. So if you then open that and look at bereavement, there's something called a major depressive order. And there used to be a 2-month exclusion on bereavement, for instance, as to whether you would be diagnosed with a major depressive disorder, i.e. That you shouldn't take into account this diagnosis if somebody had recently had a loss in their life. Well, that was lifted in the latest version of the DSM manual, which has only really been around since the late 1950s. And updates are happening every 10 to 15 years of diagnoses. And it's a list of symptoms which are then used to describe, let's say, a treatment, which would include the application of drugs. So in terms of the terminology that we're using with disorders, even including those people that have been grieving for more than 2 months, this should be considered as a depressive illness, is really, the reason why there is so much stigma attached to mental health, in my opinion. It's an overdiagnosis, an overuse of the medical model. And we had a more open discussion around the challenges that face us as human beings on this planet that we're all connected, that we're all facing very similar problems and challenges, and that we all need to help each other in terms of finding a way forward so that we can live on this planet in with ease and supportive, is one of the biggest challenges that we're facing in modern day society, in my opinion.
I have goosebumps, David, by what you're saying. Yeah.
Yeah.
I mean, there's all the regulations, and I think Anthony, and when we first started series 1, it was looking at how mental health program was put in place as a result of something like German Wings, and something as serious as German Wings crash, right? Where where the air crew was kind of diagnosed having mental health disorder, but ended up being a suicide attempt. But whereas the day-to-day people that are going through the issues, and on a much lower continuum, had to have no avenue to seek help because the system protects against, right? The medical world, the regulators, right, protects against something dramatic like German Wings to happen. But the bulk of the people that are in need of help in this time, especially during COVID, have no avenue because of the stigma of the other.
Mm-hmm. Let me also take this opportunity to remind the audience that if you have a question, do feel free to type it in the chat, and we will have that a brief Q&A session towards the end, if you will. Katie, in the recent chat, I remember you're mentioning to me that something about currency versus proficiency.
Yes.
What was that about? You had heard something maybe through work?
I wanted to ease into that conversation, Anthony, but this is a good time as any, considering that David did bring out because it kind of related to management's need for survival during COVID, and also crew, taking care of the crew. But also at the end of the day, we're here as an avenue for safety, right? All this is about maintaining safety for our industry. In one of my recent classes, one of the very highly intelligent, highly experienced pilots said something really poignant, and I haven't forgotten it until now. When we were talking about kind of aviation restart, threat and error management, and we discussed the topic of being current, right? Meaning, am I legal versus being safe, right? That's your proficiency, right? And being in a business aviation world in this climate, where management companies are taking care of making sure that kind of navigating very carefully around clients' needs and crew's need for training, right? With COVID exemptions, where they can postpone some of the trainings by 3 months or so, maybe a way to negotiate with the client and the regulators, if you will. But the poignant point that this pilot mentioned was that in our industry, in business aviation, in this current climate, being legal usually is the minimum requirement to be safe. But in this climate, being legal is almost the maximum we need to negotiate, let alone be proficient, be comfortable that you are safe, getting enough training, right? Enough sim rights and all of that. Being able to even maintain the absolute minimum is a negotiation because it comes with cost to the client. So I think this is a huge safety. I'm not sure if I'm opening a can of worms, but
we should definitely.
Yeah.
Now's the best time now to,
yeah. Kind of leading to the holes in the Swiss cheese, if you will. Not that we have any answers in this platform, but certainly something for us to kind of open as a discussion. I know we have different groups of people that are listening in to our podcast today. From management, from crew, and so on.
Yeah, I'll step in for Patrick here for a couple of moments. He would have been our pilot speaker. I only fly privately, so I'm not able to comment on business jet sims and so on. I fly fixed wing and also rotor wing, and I've been flying for about 15 years now. As I'm sure all the pilots here know, and in case we don't have all pilots here, give some cabin crew and some management as well. The legal requirement to stay current it's a far cry from what I think is necessary sometimes to be competent at something, to be proficient at something. The regs are written decades ago, right? In the U.S., you have the FAA regs that are written, I don't know, 60s, 1960s maybe, right? Not much has changed in terms of hours required to maintain legal currency. And so if it's day currency, night currency, IFR currency, whatever it is, those regs were written in mind with the kind of technology that existed decades ago, right? Imagine the complex type of aircraft that we have now, and the regs are still mostly the same. And so it usually takes a pilot to train well above the legal minimum as required by the regulator to achieve his or her level of comfort with the aircraft, the relationship between human and machine, right? To have that really, for the lack of a better term, that symbiosis between a pilot and the aircraft, right? So if you're now aiming at most the legal minimum, which was never designed for that kind of optimum symbiosis, then it's really cutting into the margins of safety, that we should have, that all air crew should have, which is as plenty of recency of experience, plenty of sim training, like you said, emergency training, stuff like that. So it's a pity. Incidents and accidents, all those, they're all part of a chain of events. They all happen via a chain of events. It's never just one cause. And so when you have now one reduced margin via training only up to the legal minimum, now you have more chains added to that chain of events that could then potentially lead to a mishap. And so as an airman, I am generally concerned about that as well. So let me see if there are any questions.
I remember
here.
while we're looking at that, I remember during SARS, the time of SARS, commercial airlines like Singapore Airlines, right? They were really maximizing this downtime for a lot of crew training, right? So that the industry at that time really had the right frame of mind in terms of let's maximize training, let's get our products ready. Whereas with COVID, it's kind of a different situation, right? It's been extended. There's a lot of uncertainties, a lot of companies not even knowing whether they'll survive through this. So I guess then training becomes part of the almost do what we need to do just to be able to maintain being able to fly the planes, right, legally.
Right. So, there's also one point I wanted to bring up that we mentioned earlier. I think it was by David. So, I mean, this is about building mental resilience. Okay. But it's interesting. I mean, I have many aircrew friends. Let's talk about personal experiences now. I know aircrew who are, for example, they are okay. Let's see. How do I start this? If it's I'm trying to be careful not to represent aircrew since I'm not one. Let's see here. there are many ways we can go about building resilience, right? I mean, it's a topic that's uh, rather vague, but I see, for example, we can break it down. Um, it's if we want to have mental resilience, we also got to have the building blocks that form up to it. I see health, for example, as fitness. Okay, that's how I call it, fitness. There's physical fitness, there's mental fitness, there's emotional fitness, financial fitness, and for some, there could be spiritual fitness. That's up to the individual, right? And when, for example, we have somebody who is out of a job, okay, out of work, many pilots that are been made redundant, for example, now they lose financial fitness, right? How does that affect, right? Branch off and affect their physical health, their mental health, their emotional health, right? Is that actually or fully a mental health issue? As I've talked to a lot of pilots about this. Maybe if they're out of a job or they're in between the job, maybe that's not as much of a mental health issue than we think it is. Maybe it's actually it's a genuine it's a real issue of not having a job, and to fight against depression or mental health issues while not having job security. Well, that's a whole other battle. First is it really is to fix that financial health issue. Is to that in itself must also be solved, and then you have a mental health issue. So even if when you're out of a job, even if you can somehow find a way to conquer mental health issues associated with that, you still got to find a job, right? That's a real issue. Second, we have pilots who are okay. They still have the contracts, not so much in terms of pay cuts, yet they could be going through their quarantines, not seeing their families, or in some cases, that could also have benefited them if they want to quarantine, if they have their own reasons to stay away from family for whatever reasons. Could be disputes, right? Could be having a certain number of disputes with their spouses, issues with their kids. So maybe in some ways quarantine's actually helping them to keep apart, right? It really can go either way. There's so many directions this can go into, and that's why we were talking about how it's worked for somebody. It hasn't worked for a whole bunch as well. What can we come
Anthony,
up
I
with?
guess that when you haven't worked and then you were appointed and you go through the retraining exercise, if you like, if you're working for a different carrier, and the pressure that you might feel, the feelings that you might have brought with you from the process of having been let go during the pandemic, it adds to the anxiety of the new flight. And you mentioned the word competency, and when particularly pilots who they're very focused on flying and being 100% professional and competent, to then push aside any feelings of anxiety might present, whatever those reasons might be, is difficult. And over a long period of time, if the emotional issues begin to be pushed back and pushed back and pushed back, they rest and they take hold of you. And it's why somebody would maybe suffer from a complete dysfunction as a result of continuously pushing back the emotional issues, where to the position of it does begin to impinge on safety and competence. So it can't be ignored. To build resilience, obviously talking about it does help, being connected to people that are empathic and do listen and help to share the issue, but also doing things for self in terms of making sure that you're healthy, having endorphins induced by getting some exercise, going outdoors wherever possible during the day, at least 30 minutes of exercise if you can. All of those good things that you need to include in your life, including getting enough sleep. So if you're laid off, at least it gives you the chance to catch up on your sleep and make sure that you have the 8 hours that you do need to add to your general sense of well-being. And to eat healthily, of course. Those are the things that would build the resilience that you're talking about, Anthony. And then I guess there's a fifth pillar in our health, and that is to be grounded in the present moment. So often we worry about what's happened in the past and how that's going to affect our future, or what we might have done in order to change what happened in the past, but we can't actually do anything about it because it's already gone. And also the past will be an experience by other people, not in the same way that you've experienced the same event. So in effect, we're over worrying about something that's already happened, that wasn't even experienced in such a negative way that you experienced that. And in the same way that we worry about what might happen in the future or what challenges may present, well, we don't know whether how we will react to that because it's not happened yet. And when it does happen, it's only ever delivered in the present moment. So we spend a lot of our time, we've got 77,000 thoughts running through our mind every day. In the Western world, around 80% of the thoughts are negative by implication. And so we begin to build neural networks and use those neural networks so often that they become ingrained, almost automatic in our thinking. And that's when problems develop. So it's not shared. And if you're not kind to self, rather than listening to the negative mantra that's going on as a background conversation in your mind, then that's when the difficulties arise and a safety issue would be apparent. So following those rules of maybe grounded and more present moments, and I'm talking about mindfulness, meditation, just centering ourselves on breathing, doing box breathing of 8 seconds for the in-breath, 4 seconds within our lungs, and then 8 seconds on the out-breath. Just centers ourselves in the present moment. Particularly if maybe we anticipate that we're going to have a stressful flight or experience as we go into work or prepare for work, particularly if we've had a long period of layoff.
David, what you just said is so close to my heart personally too, in terms of the fifth pillar. And I think having mindfulness practice has been life-saving in these recent 2 years. And I if any one of you have practiced mindfulness, I think you can relate to that. Also, for me personally, in dealing with the loss of a loved one to mental health, it's the mindfulness practice for myself has been crucial. Just kind of being in the present moment. And now, even as a day-to-day practice, before I came on this, I spent 5 minutes doing my breathing just before we started, right? And this could be something that we're not asking people to be monks sitting, meditating for hours. But with a daily practice, it's something that you could prepare when you're going through the anxieties during quarantine to as you're about to prepare for your flight, Anthony, you mentioned the different scenarios. There's so many different scenarios
So many
to what people are going
scenarios.
through. I mean,
Absolutely.
if I could add one more, there's also another group of crew who have been sitting idle for a year, and then suddenly they've been told, okay, they're all out of currency, and they've been told, okay, the client now wants to fly, right? And now,
Yeah.
while they have a week or two or three to prepare, when this is the time when they need to get grounded, prepare for their flight, go through all the threat and error management strategies in times of COVID, they're going through back-to-back training and training because they're out of currency, right?
Yeah.
And they're not ready to go on their flight because there's no time to breathe, right? And then tomorrow, once the minute they're checked out, tomorrow your flight starts. There's another scenario to add to that. So having those, mindfulness practice that you have through your life I think is going to be life-saving for those times.
Absolutely,
And
Katie.
I don't want to keep I know that Patrick's come on. So
Yes, it was for the last 15 minutes. It was actually my fault. There was a guy with the name Anthony Lamb, which is my name. I was like, "Who is this guy with my namesake?" Actually, turned to be Patrick, because I sent him a Zoom link, my Zoom link, and I think my name was embedded into the link, and so I see myself joining, but that was actually Patrick. He's in now. He's muted. Patrick, if you're able to come on. Into the mic here. Floor is yours, man, and tell us how you're doing over there. I think you're in Shanghai, and you just freighted an Airbus, right, from the States to China?
Yeah, hi, Anthony. Hi, everybody. Apologies
Hey.
for being a little bit late in joining. Some unforeseen circumstances here that we were dealing with. Initially, just going through security and screening. So right now, I just got on the pre-dep in Shanghai. I just spent 21 days in quarantine. So ferried an aircraft from Mississippi all the way to Taiyuan. Did I get that right? Taiyuan.
Yeah, that's right.
So
Yeah.
it's a second tier city. So they're kind of not used to handling flight
Foreigners
crew coming in.
Yeah.
Yeah, foreigners coming in.
Yeah.
So we were brought to the government facility, and there was a bit of a back and forth between border control. So what we thought would be a 14-day quarantine actually extended to about just a little over, now a total of about 23 days, to include the adjustments for the flight bookings that we had to do. So we had that done, and we had that covered. So finally we're on our way out. So we had a bit of an issue there. Give me a second.
Sure.
So
No problem, Patrick.
if you see the background, it's going in because I'm still in the airport.
Yeah,
So yes,
no worries.
I was able to experience firsthand the isolation of what it's like to be in quarantine, and the challenges, the mental challenges for you when you feel claustrophobic. You're in a 20 square meter room that's about 215 square feet total, and you're just stuck there. And a lot of things are going through your head. I can imagine many pilots who go to quarantine, and the scariest thing that can happen to you back home is a loved one getting sick or worse, because there is nothing you can do to break out of the quarantine. You are trapped there, and if it turns for the worst, God forbid, you will grieve alone. And that is one of the scariest thoughts that can actually go through someone who is going through the mandatory quarantine. When you're confined and there are some elements or there are some events happening to your loved ones that you have absolutely no control over. And it will really take a toll on you. No matter how strong you think you are, when it comes to your loved ones, that hits right at home. And it is a challenge, and thankfully it did not happen to me. But I was like, there are people, they're friends of mine who got sick with the virus. Some of them lost their loved ones, and I was wondering, what if they were in quarantine when this thing happened? How are they going to cope? How are they going to go through it? So those are just among the things that pilots would go through, and that would really be the straw that breaks the camel's back there. But for us, as earlier, I was monitoring the mental health, our webinars. I was going through immigration security. And yes, one of the biggest issues for us as pilots is that we are alpha personalities. So we always have we always have to show or come from a position of strength. If you're a captain, you set the decorum in the flight deck, and you would call the shots. This is my command responsibility. If you're a first officer, you would also have to show your captain that you're really up to the job, even if deep inside you feel emotionally you're crumbling because there are some issues that are actually eating you up. In the flight deck, we practice CRM. We use the human factor as a resource there, as part of the overall safety that we actually do every time we conduct a flight. But individually as a pilot, we're also the alpha, but we're just able to function together in a flight deck because we have fixed duties and responsibilities, and we can function and do those things. But it doesn't really mean that we are okay. We are very good at hiding our feelings. And one of the biggest problems there, if you're not able to speak up, is that you would have that false sense of security to saying that, hey, I'm able to practice resilience. I can do resilience. It's not a problem. I can bounce back even if something's eating you inside. But actually, there is also a thing we call like risk anticipation, when you're also too careful, and you think by being too careful that's part of a safeguard for being resilient. But actually, that gives you a different level of anxiety, especially if you're not current. It gives you a certain level of insecurity on your subconscious. And I have seen a trend, especially for those in the airlines and some in the corporate aviation world, wherein lapses are happening in the flight deck more, and it's more pronounced now during the pandemic. Since 2020 to 2021, there are certain operational lapses or procedural lapses that are done, and some of these lapses are kind of strange. These are new. These are like almost like a black swan lapse, wherein what would be very routine for you, somebody would like, what were you thinking? Why do you do that? Like, for example, a person is passing above 20,000 feet and wants to deploy the speed brakes. And for a captain, that's right next to your right leg. But instead, subconsciously reaches out on the other side of the console and at the pedestal and pulls out the flaps. Things like that. Forgetting to lock their speeds, ending up landing on a nose wheel. These are things that we've never really seen before pre-pandemic. But we kind of think, why are these things showing up? Why are we having a higher incidence of hard landings? Why are we having a higher incidence? These guys are skilled. These guys have thousands of hours of flying time and training, and they got good grades. These guys are sharp. They've been screened. They've been trained over and over again. And then suddenly these things are happening. And people are just quiet. Then management will say, oh, maybe it's a skill issue. But the issue is deeper than that, and we really need to talk about this. This is important now. We really need to discuss mental health. Mental health does not mean there's something wrong with you. Mental health is talking about this. This is your ability to cope with the crisis that's going on, a personal crisis, a career crisis, aside from a global or an economic crisis that's actually also affecting you, your loved ones, your future planning, your career planning. There's this disruption that you've never seen before, and you are actually you are struggling to come into terms with this, to wrap your head around it. Say, how am I going to cope with this? How am I going to tackle this? What is the future of my children? What about my savings? What about my retirement? Or what about my career plan? Suddenly it's scuttled. The fleet is being downsized and everything, or the owner decides to park the jet and says we're not going to be flying for time, so he's going to have to take these measures, and it directly affects all the flight crew. And not only for us in the flight deck, the cabin crew, the maintenance and the engineers, even the air traffic controllers, even the other the ground staff who do the ground operations and the ground support operations. Many people are affected because the virus the virus and the pandemic does not select who their victims would be. And this is not just affecting you medically, but it has affected everybody economically. I mean, the global landscape has changed because of this one. So these are the effects and the ripple effects that we're feeling every day, and we're coming through year 2. You know, vaccines are out, vaccination numbers are rising, so there is hope. We're beginning to see a bit of some light at the end of the tunnel. People are talking about learning to live with COVID, learning to do this. But what about the ramifications to the individual, to us in aviation, the effects that would actually stay, and for us to be able to recoup and come back, to maybe 2019 levels or near that level? The effect is here to stay, and we will be dealing with that until we can say at some point that, oh yeah, I'm kind of back on my feet again. So yeah, that's from where I'm sitting as a pilot. These are the things that some of my friends are also sharing, but not everybody wants to talk about it. I know some people are, they're just hanging in there, and then they don't want to speak up. They're afraid to speak up. The thing here is that it's about support. Among pilots, we need to put a system of social support to be able to open up to another pilot you're comfortable with and say, hey, I'm going through this. But it's also important for management to also be able to understand the effects of the morale, to have to be able to also feel what the people are feeling, what your workforce is actually feeling. You have to have that empathy there, and with that, if management is educated enough about the effects of this one, and it's hard to measure this in terms of the metrics of how successful your mental health program is, but at some point you need to design a system that you integrate it into your safety management systems, and also for the safety office to also spin off a smaller unit that would be able to train peers, to put the system for handling information confidentiality. And if on the rare occasion that things would really go bad, then overtly you could actually then come up and also enact an intervention. If you need to pull somebody out of the schedules or reduce the workload, just for them to be able to get some breathing space and be able to get their bearings and be back on their feet again, we need to put those protocols there. But we have to be conscious not to also violate the person's privacy. So those are the things that we need to also look at. We need to put all those protocols in place. I have to mute this a bit.
Thanks, Patrick. Very insightful. We talked about measuring. Okay, just now, I think there is something we can maybe currently. We are currently measuring it by way of a survey for aircrew that OSBA sent out. We released a survey with 14 questions to the attendees, and I'm interested in I'm inclined to share the survey now. These are, of course, prelim responses, very preliminary, so it's not quantitative in any sense. But I think it's still noteworthy to see some of the responses that have come in so far. We've got about 20 responses. Let me share my screen here, and we can all briefly go through this. And of course, Catherine, David, Patrick, feel free to chime in anytime, with what you observe on the survey here. So let me share my screen here.
While Anthony is doing that, could we also add a call to action for people that are listening, that if you could pass this information on the survey on to your colleagues so that we can get more accurate data on this. As Anthony mentioned, this is preliminary, so the more information we have, the more accurate the data can be.
Thanks for that shout out, Katie. Definitely. We did send this out to a lot of crew departments, and we do think we can get a lot more responses than we currently have. We will keep the survey open for the rest of the year, so it will be up to date as of this last quarter, we should say. So let's take a look at the first one. 100% of the responses to the survey from pilots, so none from flight attendants currently. The second question is, how much has the pandemic affected your mental health? So have you experienced anxiety, depression, insomnia, eating disorders, difficulty in focusing, so on and so forth? So let's see the data here that we have so far. 45% says somewhat. So they acknowledge that they have had it. It exists. 35% said significantly. 15% says not at all. Let's go to the next slide here. How adversely, this was the question to the survey takers, how adversely has the need to quarantine itself and isolate due to the nature of your work has affected your mental health? Half so far have answered somewhat, with 35% significantly. So you have 85% here acknowledging directly that the need to quarantine has affected their mental health. Right, that's 85%. Okay. Only 10% says not at all. And how much, now we went over this in the last hour as well, how much do you feel COVID has exacerbated other factors that may have affected your mental health? For example, your family, your spouses, partners, children, so on and so forth, 45% significantly. So we have close to half that's acknowledged that external factors such as with their family, spouses, partners, and children, so on and so forth, have contributed to their mental health decline, for instance. 30% says somewhat, right? So 75% here, right? That is a by and large majority saying that that is an issue. Let's go to the next one. Oh, okay, that's also severely, 20%. Let's not forget that as well. Okay. So this is an enlightening response so far in question number 4. Let me get my Zoom back on here so I can make sure I get your questions if there are any. So far, so good. Okay. Separation of families, quarantine, something we need to keep discussing. How stigmatized do you feel the subject of mental health is among those in your profession? 40% thinks it's severely stigmatized. 35% significantly. Okay. 25% said somewhat. Nobody said not at all. So I think we can all agree that this is a subject that is stigmatized in this industry. Any comments so far from anybody? I'll be taking a 1-minute break after every few questions here.
Yeah, I think that it's quite clear that the answers are that there is a stigma here, and that everyone maybe who took this survey doesn't feel that they can share it with their employer. So it's up to employers, and to earlier, that management have a real role to play here in making sure that the vehicles and support is there for those that are experiencing difficulties. And so companies that subscribe to an employee assistance program, like the company that I work with, Workplace Options, which does provide statistics around what people are dealing with in a confidential way, and yet provides confidential support to those people at the front end experiencing the difficulties, and they will be helped. To provide the peer pilot programs, even if it's not in an EASA area where that is a compulsory to have, to do the same for cabin crew, to be able to have vehicles, to be able to share what is experienced within the industry, and maybe to take advantage of initiatives like Medair have at the moment a complementary wellness support program where we will come in and we will assist management in an overhaul of their mental health support strategies, and we'll do that on a complementary basis to assist in terms of finding a way forward to support staff in this very, very difficult period in the pandemic, where we've got an additional anxiety around coming out of the pandemic, where we've been conditioned into staying away from not being around people. And then we're being asked to go right back into it. But also it's there as a constant reminder in that we're quarantining for weeks on end, in some cases, Patrick, and we're disconnected from our families. So this needs robust support, which needs to be confidential so that people can feel that they can access those services.
Thank you, David. No other questions here. We can go on to next survey response. If there are significantly fewer repercussions and consequences to your medical or to your peers' medical certificate, how much more likely would you be open in discussing and reporting mental health concerns? So we got half as reasonably open to discussing mental health concerns, and we have 35% that's very open. That's quite encouraging, I think. Yeah. Next one. Uncertain, 15%. Okay, so wait and see approach as to how the regulators might perhaps phrase their terminology and their clauses in how to exempt air crew from repercussions. That's fair as well, I think. Let's go to the next question. Does your employer have a peer support network currently? 40%, which is the majority here currently, does no. We have 30% does not apply, okay. And a third so far said yes. Do you feel, next question, are there enough resources from your present employer to help mitigate these issues? 60% have said no, not enough measures, not enough resources, excuse me. 15% says yes. Okay. A quarter of resources. Go on, please. Yes.
Yeah, I think question number 8 also kind of validates some of the assumptions I had earlier on in the, especially last year, because not only are we taking care of the air crew directly through like crew resource management training and other avenues, the office staff at the management offices too, right? They go through their fair share of pay cuts, forced leave, and also, you know, kind of working on shifts and having to manage when they are working from home. They have families and children and all that to take care of. And I think not so much in Hong Kong now, but perhaps other Asian region, that's still the case, where people are still doing staggered work or working from home. But at least in Hong Kong, it's opening up. There's less of I think, mental health pressure. However, I remember last year, my company started to offer mindfulness training as part of a complimentary course, and I'm really delighted that MedAire is doing the same. I think, and if I could say, please take advantage of this of this opportunity. We offered it at a very kind of personal level to our clients, free of charge. Some of our clients would jump at the opportunity because they really want to take care of their staff. Some, I think, because they're going through so much of changes within their own, you know, department that it's not something that they have the spare capacity to do. So I think with MedAire doing this initiative, I really would like to invite more people to attend, I would think.
Thanks, Katie. I am reading back to some of the questions before we get back to the survey. We have one from Glenn here. Great points too. He says we have multiple resignations from air crew who have faced these regular quarantine periods. Opportunity for OSBA to act on behalf of the flight attendants and pilots to possibly have a different type of quarantine. Absolutely, Glenn. I am going to, just an example of what OSBA is currently doing. We have written to and also liaise with the government in Hong Kong, for instance, to try and alleviate this issue with crew quarantine. I'm going to share my screen here momentarily, and you will see an example of what we try to communicate with the governments with this regard. Share screen. Let's go with, it's going to be my PDF file, but that will suffice. OSBA letter. This was last week, actually. We wrote to multiple government departments that are relevant. This one in particular is a Chief Port Health Officer from Hong Kong's Department of Health. We have written them directly to represent our aircrew. This one in particular is for Hong Kong, and we have similar ones for other chapters as well. As you can see, DQH, quarantine hotels, we are respectfully requesting the process to be available as businesses for business aviation, same as airlines as well currently. For short trips, they shouldn't require the same type of quarantine. Same for hotel issues. There's a lack of designated quarantine hotels in Hong Kong currently. And so if, I think there are cases where flight crew are staying in non-DQHs just to wait for a room at a DQH to be available. So they wait potentially indefinitely. And then once the room is available, to get transferred to a DQH and then start the 21-day quarantine. That's ridiculous. So for that, we've also requested for the Hong Kong government to open up additional hotels to be classified as DQH. So just a couple of preview things working behind the scenes at OSBA to hopefully alleviate crew quarantine concerns. There was another comment. I think they were quite interesting. I was not aware of this before either. Glenn also mentioned here there's very little empathy from anyone in China for anyone who presents themselves for quarantine. They were more concerned with removing cans of tuna from Glenn than any kind of strategy to reduce anxiety of the person. So I think that's definitely a point we should discuss perhaps in a later episode. Since we are coming up on time, I'm gonna, if the participants are okay, I'm gonna extend this a little bit, give us a little more time to go over the rest of the, we have, I think, just 2-3 more slides on the survey responses. David, are you okay? Katie? Extend
Yeah,
a little
I'm good.
bit? Okay, thank you for that. Patrick, if you need to go, let us know. Otherwise,
I'm still good.
Okay,
I'm
great.
still good. All right.
Fantastic. Thank you. I'm going to share my screen for the survey again, and we'll continue with the slides here. Okay, next one. How adversely do you feel mental health has affected or can affect your work performance? So this, Patrick, feel free to chime in as well. You did mention about some of the lapses in procedures, deploying, I think it was flaps instead of, was it Patrick?
Instead of speed brakes.
Speed brakes, okay.
They put the flops out above 20,000. That's above
Jeez.
the limitation for deployment.
My goodness.
Some aircraft. Yeah.
That's above the hard limitation. So let's see here. It's kind of split for this one. Interestingly, 30% is somewhat okay. 20% severely. So we have half of the responses saying it's either severely or somewhat. That's affected their work performance. So operating in an aircraft, right? Half of them. And we have significantly for 25. So 75%, it's a definite yes in some way. We got to revisit this once we have more responses as well and see if this is consistent. How adversely do you feel mental health has affected, can affect aviation safety or the safe outcome of a flight? Half says significantly. A quarter says severely. So you have, again, plus 20% somewhat. So you have, you have majority here, all of them saying it basically, they think it will affect the safe outcome of a flight. No one so far is saying that at all. Okay, obvious safety concerns from the flight crew themselves. Have you reported sick? This is an interesting one. Have you ever reported sick for work due to mental health issues? Okay. Split half. I would not consider doing so, half the group says, while the other half would consider doing so. I guess this might depend on other considerations, whether or not they're perhaps what kind of maybe punitive or other consequences, that may arise, I guess. Split decision. Next question: have you received assistance and support?
Just very quickly,
Yes,
Anthony,
please,
on
Katie.
that point,
Take your time.
it really is 100% saying no, they wouldn't, but some would consider and some would not.
Oh,
consider,
sorry.
right?
Yeah. My
Which
mistake.
means 100% are saying no.
100%
which,
no.
Again, the stigma.
Yeah, my mistake. Reading a little too fast there. And so 12, we have you received assistance and or support from within your own peers, in their own circle of peers, in relation to mental health? So this could be construed as peer assistance, network support, that type of thing. So far, the majority is no, 60%, with only 35% saying yes occasionally. But no one so far is saying yes regularly. Okay. I think we have a next question that is related to this. This is the last one on the list. Have you given assistance? So to contrast with the previous question, right? Have you received assistance? This one is, have you given assistance and or support to your own peers in relation to mental health? They could be going through depression, anxiety, panic attacks. If so, how often? 65% is saying, yes, I've given assistance occasionally, with regularly doing so at 15%. So you have a clear majority that feels they've been providing that type of peer support, that type of network assistance to their colleagues, their peers.
Yeah, so everybody is supporting each other in their teams when they feel able to, and some don't feel able to. Still, a fifth don't feel able to share their issues at work, or give support, or have supported in that issue. But also, if it was felt that there was more supportive management of these kind of issues, then they would be more open to discuss these issues. So we have a reluctance, in a sense, to admit that there's a problem, even though that we know that there is, and as Patrick has reported, there are a higher incidence of safety issues going forward as we're coming out of the pandemic. So what's going on here? And there perhaps does need to be in the industry more support and more guidance, maybe from regulators as well, the chief medical officers of the regulators, in terms of how we're going to address this issue of wellness and robustness going forward, and providing appropriate support, like ensuring, like MedAire can provide an app which will allow for regulation quarantine and search for hotels that do that. So putting those things in place that matter, having a certainty as we come out of the pandemic that we're going to be treated well and supported in a new normal.
Thank you, David. I think also from the comments here, just going back to Glenn's comments a couple minutes earlier, he says absolutely punitive if you reported sick for mental health issues. Yeah, Glenn, absolutely. What the survey, I guess, was trying to ascertain was whether flight crew have reported sick and not disclosing it was due to a mental health issue. So have you just reported sick just for being sick? Let's say you have a cold, a flu, whatever it is. But in reality, it was actually because you had mental health issues. So I think that would be an interesting response or feedback to glean on. And Glenn also brings up a valid point about cultural issues in Asia. I think culture plays a huge role in this, in how even a regulator might approach this issue. East versus West again, right? How far has each region of the world come along in understanding mental health issues, in understanding real solutions? Who's ahead, who's behind, who's making headway, right? So I think we should also revisit this problem, this subtopic of cultural issues that underlie or even underline mental health understanding and solutions. Okay. Some more comments here. Okay. I'm going to take, let's give it 1 to 2 minutes. Okay. Feel free to discuss among ourselves. Otherwise, I'm just gonna leave, let's say, 90 seconds for questions. And then if not, we'll start wrapping up, and we'll look forward to revisiting some of these deeper topics again in episode 3.
Anthony,
Patrick,
can I? Yeah.
Please.
Well, on the chats, we're talking about. We're discussing a bit about the organization, and
Yes.
this has to do with. This mostly touches with how the top and middle management actually see mental health, and how it could actually affect the guys who are on the line or the line people. That if you call in sick and say, I have mental health issues, yes, it could get you in trouble. It could get you terminated. It could get you ostracized within the organization because of stigma that goes with it. As I mentioned, there will be rulemaking that's going to be coming out on this one. I think IASA is going to be writing about it. The FAA was going to be writing about it. And when the regulators come in, it becomes, when it's written in black and white, it becomes an audit issue. And it becomes an audit issue, hence it also becomes a quality issue, because they will look into your organization of what you have and how you implement it, the execution of your system, your program, how you train the people, metrics, if you have any. So this would force the organizations from the middle to the top levels to give it a second look and say, okay, how do we deal, or how would we put a system that deals with our flight crew and our overall organization in terms of mental health? What kind of program can we put there? And the best approach for this one is to be able to also pull in the guys from, let's say, from medical and from safety as well, and also from operations, to put the peer training program among the pilots. And this would form some sort of a support system from within the organization. And confidentiality is key, because there is a trust factor that's very, very crucial in this one, that when you open up to somebody because you need help, he's not going to tell on you or put you in a bad light that could actually then land you in trouble. So there has to be very, very careful screening when it comes to how you train these people. And of course, legal will be involved, because there would be the privacy issues, and it depends on the country where you work. So every country has their own privacy laws, the same way the doctor will have a doctor-client relationship in terms of the confidentiality of your prognosis or what you're seeking treatment from. So in the same manner, it goes there. But this is not, pilots should understand, this is not psychiatric treatment. This is a support system of helping you to become fit overall. Because as a pilot, we always say, I'm safe. I slept well. I didn't take any medication. I'm kind of okay. There is a checklist. I didn't take any drugs or any prohibited prescription medication that could affect my ability to fly, and so on. And we can rattle off this checklist every day we show up for work and say, yeah, I'm safe. I'm okay. I didn't take any alcohol or any other substance is bad. And they just go about their day. It has become so routine that many times some people actually begin to bend the rules. You know, the normalcy of deviance actually just gets in there. It's not just operational, it is also personal. For us in the aviation industry, it is always important that personally we have that balance. We're physically fit because we have our medicals. Of course, we also have our skills and our academics there. Our paperwork has always to be in order at any given time, down to your passport, your licenses, your compliances, your check rides, and all the other things that you need to do. Of course, on the holistic side, on a more personal level, even your spiritual side, you know, on your faith, you have a firm hold of that. That also forms up your value system, on your personal values, on how you do things, how you execute things. It gives you that moral compass that you need. So you need to have that also squared away. But people we haven't really discussed mental health in the way that we see it now. It is because we're just learning about it. And the irony of this is that this is not really new. And I saw an old clip of the Apollo 11 crew after they came back from the moon, and Buzz Aldrin struggled with alcohol abuse and some substance abuse in the 70s. And Buzz Aldrin actually said, hey, it is a mental issue. It's a mental health issue that they were also dealing with from all that, you know, all that training, all that isolation and the pressure of the mission. And they came back, and he mouthed the words mental. You know, this is a mental health issue. And this was in the early 70s. So that's like more or less 50 years ago that they already know about this. We move forward to what we have now in terms of how we understand the brain, you know, how it functions, how people react, how all of these, as you mentioned, the synapses, and how all of these work. As David mentioned earlier, the medical side to it, the science to it. And right now, there's so much new technology that's going out there that would even surprise most of us. Like there is transcranial direct stimulation, DCDS, wherein you can wear a headset that can actually inject a low voltage current through your skull directly into your brain that helps assist when it comes to your motor function. That would actually help you develop muscle memory. It'll help you actually train. I have one of those because I use it for my sport. When before the pandemic, I was into triathlon, and I saw the Halo Near Sport, and I found out it was also taken in by the Air Force Research Laboratory. The U.S. Air Force Research Laboratory gave them a grant to actually also promote this to improve the reflexes of pilots. And there are rumors swirling around that it can actually also be used to improve cognitive abilities, your reaction time, and maybe one day you're going to see something or information may be directly transferred to the brain into those means. So we have advanced by leaps and bounds that some people who are talking about this have a deeper understanding of the value of having a crew mental health system within your organization. And if we move forward and we throw in machine learning, we throw in AI a little bit more into the future, it is not far off. If you saw the movie Ad Astra, it is not far off that you're going to have something like that happen.
Yeah.
Where you can put a bio patch into your neck. You're going to speak into a console, and you're going to say, I'm good, I slept well, I'm motivated, I'm driven, I'm this and I'm that. And it not only measures your TPR, your temperature pulse rate, but it also, your voice pitch, your stress points, and all the other biological readings that you have, and it's going to clear you as fit to work, fit to fly. And we can actually see in the near future, we're in a very, very basic code or algorithm of the human psyche and it's very specific to you, can actually be generated. And for you to be able to connect with the system Every day you're going to report for work, and it's going to sign you off. It's going to clear you out. It doesn't mean that you're going to go up there bright-eyed and bushy-tailed, and you're going to say, hey, yeah, I'm good to fly. There may be days you can be really honest and say, I'm dealing with something, but otherwise I'm okay. It can do all the biometrics on you and the psychometrics on you and still clear you to fly, still clear you to work. And this is not just sci-fi. This is very much the reality of what we're looking at, and said, you know, it's going to come to that. And people will say, yeah, it might go into my privacy. It might go into, well, it doesn't really go into your thoughts. It basically just really goes into your psyche. Are you fit mentally? Is your morale there? Are you really, you know, do you really have your eyes on the ball, as we say it, that you're sharp enough to focus on the task that you need? And in aviation, the more we say, it's more information is given to us as new technology comes in. It actually is, the complexity is actually increasing. Sometimes we find ourselves with information overloads, and any distraction that's sitting there in your subconscious that can cloud it is going to have a domino effect in how it's going to affect your performance, and overall it's going to affect safety. So it does not really mean that technology is making all things easier. It's giving you more available information. It's helping you with so much tools, but how you're going to deal with that, that's another thing. And that's a totally different thing. Your skills would come in, your training would come in, your experience would come in, and definitely your mental health of how you see things. It will all play into that. So these are the things wherein the organization from the top, from the very top, whether they like it or not, right now they can just say, okay, you said you had a mental health issue, and okay, we're going to sort you out in the name of safety, we're going to fire you. But eventually it is going to change. It is going to happen. And whether we like it or not, we're slowly getting a glimpse of what's to come. And we just have to start now. We really also, after this, we really should look at how we are going to put a crew mental health program into our safety management system, how we are also going to put a structure into our organization for something like that to be able to work, and how we're going to reach out to the people in the line, and how we're also going to educate the management to also embrace this and not use it, not weaponize this against its own employees. And that's very important.
Thanks, Patrick. It's intriguing to me how I think humans may potentially interact with machines in the future. I talked about symbiosis earlier between the human and the machine, and how AI may very well have a role in evaluating whether a human is fit to fly or not in the future. If it's already being, perhaps it's already done in the military, in space agencies, whatnot. But it's certainly now, if not now, then in the near future. We'll definitely discuss more of this in the next episode. I'm going to now go around, make sure that Katie and David, you got any parting comments before we wrap up? Feel free.
Just a quick
I'd just
one.
like to. Oh,
Please, David,
fault.
go ahead, David.
go on.
Please, David, go ahead.
I'd just like to follow up on what I said, is that, we really are learning very fast around, new developments, and it's really important to take a humanistic rather than an exploitative approach around how we might use this. I mean, neuroscience, neuroplasticity, we only knew the brain could actually grow through activities like meditation and brain scan, that DNA structure changes within seconds, hours, weeks, in terms of how we look at ourselves. There's big data projects on mental health and the ability to be able to predict the life that somebody may take their life with a high degree of certainty, taking into account lots of big data, anything up to 350 factors, which would lead to that decision to take the most highest you could possibly take in respect of your own safety. So it depends on how we use this in a humanistic way and a positive way forward in order to keep everyone safe and keep ourselves safe in terms of recognizing the signs in ourselves in terms of how we are going forward and how we deal with it. It's really important, and I think Anthony mentioned that we do the confidential way so people can feel that they're trusted and that they're trusted to do the most responsible thing.
Thanks, David. Katie?
So just one quick point going back to human factors consideration is air crew day to day, you're paid to go to work, having to balance between the two competing goals, right? One being safety, which is your priority, versus efficiency. And with COVID adding to the complexity, the efficiency in helping clients to save money and also time, right? Versus being safe, being thorough. With all of that, considering, these crew are trying to manage the constant kind of competing goals between the two while they're in quarantine, while they're going through all the job security issues and all of that to consider. And at the end of the day, it's about safe operation. So something for, I suppose, management crew and clients to consider and work together.
Thank you, Katie. With that, I'd like to head in to our conclusion here. I do want to make sure you guys get to, let me just go back to slides here, share my screen, and we will get the wrap up. So let's do screen share. So on your screen now, I do want to make sure you guys get a chance to see, if you like, a free assessment and review from MedAire on current procedures. This could fill any gaps that's needed in your organization with no commitments. So it's here if you need it. Feel free to reach out to Peter Lockhead on the email you see on your screen. Now, I do want to close off with another, the conclusion is another presentation. Let's open that one up. I do want to thank you all again for joining us in this webinar. Of course, I'll begin with our sponsor, MedAire, for the support. Also to our speakers, Katie, David, Patrick, for your time and your expertise. And of course, for our attendees for joining. Let me also reiterate that this is an initiative that is near and dear to OSPA. Okay, we aim for this series to evolve, and the key point being is that this is continuously a learning experience more than anything else. Okay, the next discussion is scheduled for December, so stay tuned for more updates. Please take care, and we'll see you all again soon. Thanks so much, everybody.
Thank you, everyone. Thank you, David. Thank you, Catherine. Anthony, thank you.
Thank you, team.
Thank you.
Thanks, Anthony.
Thank you.
Casey.